Well, hello. It's great to be here today to give you another update on where we stand with our COVID preparations and our recovery. But before I do that, let me just thank everybody. Recently, everyone knows we had a storm that came through here. Wasn't a very big deal for us, but thanks to everyone that made preparations for that. Unfortunately, as beautiful as Charleston is, we know we get storms. And so I'd ask everyone just to make sure that you've looked at your hurricane preparedness plan, talked to your service, and your supervisor to make sure you know what your part is that you'll need to play in future storms. But great job on that. So with COVID, really happy to report that numbers are headed in a very good direction for us. Across our community, we're seeing number of positive tests go down, number of inpatient admissions going down. Here at our facility, we're down to 12 positive inpatients. I think our high was about 20 patients. Went down to about 8 and now back up to 12, but really equalizing at about a number of 10 right now. As I've told a number of staff, COVID is something that in reality is probably going to be with us for a while. We're hoping for a vaccine and things that will help us even move in a more positive direction, but taking care of COVID patients as healthcare professionals is something that we're probably going to be doing for a while. So 12 patients now. We hope to see those numbers continue to come down, but just tremendous work by all of our staff in taking care of those inpatients and many outpatients that are coming to us for testing. The other great piece of news is we're down to 6 positive employees. Remember that we've got about 3,000 staff across our health system, so 6 is a small number. Every one of those matters. Everyone we're working with to make sure they're safe and getting better. They're all at home, self-quarantining, so positive direction there as well. Let's hope for continued positive news related to COVID, but thank you for all the work that you're doing with preparations and making sure we're ready as we take additional patients. One thing I did want to share with you, a story. So one of the patients that was discharged from our hospital, we try to do all we can to congratulate them, help them get out of our hospital and into their cars and home to their families. We had a patient that I had the opportunity to talk to and see as they were being discharged. Just an incredible experience, I think, for me and all the staff that have been involved in seeing our patients come in here scared, uncertain about their future, and leave here healed and on the road to recovery. This patient, as we started to wheel him down the hall, put his head down, tears in his eyes, and said, when I came in here, I didn't think I was going home. We all know COVID is a scary thing, and he literally was not sure if he would make it. He made it. Our staff helped him through that process. He's home now with family, just so thankful for the work that you guys are doing. So just remember, and I think all of us know this, but there is a patient behind all the work we're doing. We're truly making a difference in the lives of our veterans. So next steps, as our numbers have gone in a positive direction, we are talking about what we are going to do to slowly, methodically, cautiously reopen services. We've brought back a number of operating room cases, surgical cases, looking to increase that a little bit. Same thing with some other procedural areas. We're still really limiting the number of patients we bring in for face-to-face visits. Still doing great work in terms of virtual care, telephone care, care through Skype and other modalities for virtual care, but limiting the number of face-to-face visits. But we are going to be looking at starting to increase our number of procedures again in a very thoughtful, careful way, making sure we have PPE to keep our staff safe, and also testing to make sure patients are tested before they get procedures. So just be on the lookout for next steps coming as we cautiously move things forward for our hospital and for our patients. So today, you're going to get to see something we're excited about, and you'll get to see some pictures and a story of our new Seafort, our new mobile lab that is a mobile lab that was sent to us through our VA Central Office. Several hospitals were given the opportunity to get one of these mobile labs, and it's here. It's sitting in front of our hospital. We've got patients every day that are getting their lab tests in that mobile lab rather than having to come into the hospital, causing congestion in the halls, etc. And it's really exciting. So enjoy our presentation, our look at our new mobile lab. Alicia and our staff have done a great job with that, and they're going to tell you a little bit about it. Again, thank you for all you do. We appreciate you all so much. You guys are just heroes in my eyes and so many of our patients and our staff. We understand the work being done. So thank you so much. Enjoy the rest of our update.
So this mobile medical unit allowed us to set up a temporary location outside of the medical center in order to allow us to see some of those patients that only need to be seen in an outpatient setting for lab draws or for urine specimens, to come out here without going inside the medical center, have those lab draws done, and be able to leave right after their appointment without having to go inside the medical center as a whole. So this helps us with our screening procedures that we're going through at every entrance, and allowing us to take some of those patients outside of the medical center and allow them ease of pulling right up next to our mobile site, park, come inside, have their draws completed, and leave within a very short amount of time without having to go through our main entrances and into the main hospital. So this is our check-in desk, where you're going to have an administrative person who is going to screen the patient, as we're doing at all of our entry points right now to the facility, and check them in for their lab appointment in order to get their lab draws done in this building. So this is exam room 1, and this just shows the configuration of all of the exam rooms that we have, which is a total of 3. So in each room, we do have a lab table where they're able to actually put all of their lab supplies and the specimens that they'll be collecting onto the table. They do have a bed that right now is in the upright position so that they can do the lab draws appropriately in the lab chairs. The lab technician has a chair, and they also have a laptop computer so that they're able to enter patient information such as vitals and other specific information that's done during the actual lab draw itself. There is a sink in every exam room so that they can also use the sink to wash hands and or use hand sanitizer before and after each patient.